Good afternoon, everyone. Hi, my name is Vinita Mulchandani and I represent the PCOS Society of India. What is the PCOS Society? The PCOS Society of India is focused on creating awareness on PCOS, which is polycystic ovarian syndrome. The society consists of a large membership of multidisciplinary physicians such as gynecologists, endocrinologists, dermatologists, and all allied health specialists such as nutritionists, physiotherapists, etc., who deal with PCOS patients. Vijeta the Winner, a PCOS initiative. Vijeta the Winner is an outreach arm of the PCOS Society of India, which has been conceived to educate women regardless of whether or not they have been diagnosed with PCOS. We believe that understanding PCOS is essential for supporting women's health and well-being, especially its impact on her starting from puberty to beyond menopause. The aim of this program is to create awareness and share knowledge about its causes, risk factors, symptoms, and management. The most important aim is to dispel the myths surrounding PCOS. Let me tell you a little bit more about this. The PCOS Society, PCOS is a polycystic ovarian syndrome, which I've already told you. 1 in every 5 Indian women suffer from PCOS. Not anymore. It's 1 in every 4 Indian women actually suffer from PCOS. This data has just got updated. It can occur at any age, starting for the first occurrence being at the time of menstruation, which is anything between 11, 12, 13. You may start it at that time, but it can go on for longer. The majority of women are diagnosed with PCOS from the age of 20 years up to 30 years and even later. PCOS is frequently observed is mostly frequently observed cause of female infertility. Let me introduce you to our moderator first, Dr. Sushma Bhutada. Dr. Sushma, she's an MBBS DGO from Mumbai University. Her career overview looks very interesting. She's practicing in Nasik as a gynecologist since 21 years, director of Supreme Multi-Speciality Hospital, Ashoka Marg, Nasik, life member of Indian Medical Association, life member of Gynecologist Society of India. Posts held in the past: Joint Secretary of Nasik Gynecology Society 2007-8, Clinical Secretary of Nasik Gynecology Society 2011-12, Secretary of Nasik Gynecology Society 15-16, Vice President of Nasik Gynecological Society 22-23, Treasurer of Indian Medical Association, Nasik. Area of interest: managing high-risk pregnant ladies with medical illnesses. Social activities that she is interested in are various free health checkups. She does various free health checkup camps, health awareness lectures for women and school-going girls, adolescent awareness program workshop for school-going girls for both rural and urban schools, and she's participated in various delegation camps for school students. Thank you so much, Dr. Sushma, for being with us. Over to you.
Thank you very much, Vinita, for the brief introduction, and good afternoon, dear friends and the audience. Today we are going to discuss about polycystic ovarian syndrome, that is PCOS. As Vinita said, it is very commonly seen in Indian women, and this is a hormonal disorder. In PCOS, the ovaries are enlarged and multiple cysts are seen in the outer edge of ovary. The insulin level is high in the body due to high blood sugar, and all this lead to obesity, that is excessive weight, menstrual irregularities, diabetes, heart disease, infertility, that is inability to get pregnant, and lots of skin changes and lots of mental illness like anxiety, depression, low self-esteem. And all these things ultimately leads to the, it hampers the quality of that person, the life quality of that person. The treatment for PCOS is, it needs a different kinds of treatment. The treatment can control the problem, but complete cure is not available for PCOS. As a doctor, nowadays we see lots of patients, young girls with PCOS because of the poor lifestyle, eating habits, and lack of physical activity. So small changes in our lifestyle can control the symptoms of PCOS and can improve the quality of life and can really make a marked difference in the life of that person. So dear friends, today we are going to discuss the various problems associated with PCOS with our expert team. So today we are very fortunate to have a very young dynamic gynecologist from Nasik, Dr. Gauri Karandikar. She is also the young dynamic president of Nasik Obstetric and Gynecological Society for the year 23-24. She is the director and consultant of Karandikar Hospital, Nasik. She runs special clinic for growing up teens and young adults at Karandikar Hospital. She is managing committee member of PCOS Society of India. She is associated with various adolescent committees at national and international level. Dr. Gauri, she is a master trainer of Dhira, a violence against Foxy, the initiative started by Foxy and UNICEF. She has various publications in national and international journals and textbooks. Dr. Gauri, she regularly writes on women health issues for social and print media. She is a project in charge of FEM for menstrual hygiene and eco-friendly choices in Nasik. With this brief introduction, we have Dr. Gauri Karandikar, the young dynamic gynecologist from Nasik for today's panel discussion. Our next panelist is Dr. Teja Kulkarni. Dr. Teja Kulkarni is also one of the well-known skin specialists of Nasik. She is practicing in Nasik as a dermatologist since 2000. She has worked as a senior consultant at Kaya Skin Clinic. And the next panelist is Ksitija Gaikwad. She is a clinical nutritionist, diabetes educator, and certified fitness trainer. She is attached to various well-known hospitals in Nasik as a chief dietitian. Her main areas of interest are PCOS and infertility in women. Next, Dr. Rucha Sule-Khot. She is a consultant psychiatrist and psychiatric oncologist at Nasik. She is a member of International Psycho-Oncology Society and American Psychological Oncology Society. She is a center head at IPH Midlab Nasik, a community mental health center. She is associated with Gharkul, a residential school for mentally challenged women. She is the ex-honorary consultant psychiatrist at HL Hospital, Nasik. So the next panelist is Yashashree Kalantri. She has done her BSc, MSc in yoga therapy. With yoga and alternative therapies, she has successfully managed various conditions such as diabetes, arthritis, paralysis, cancer, PCOS, and mental illness. She is actively involved in yoga training workshop at corporate level. She is actively conducting yoga camps and workshops across the globe to raise awareness about the significance of yoga in our daily life. So after this brief introduction of all the team, I will start with a proper discussion about the PCOS. As I told you, now we get lots of young girls with PCOS. They come to our hospital with sonography report showing PCOD, history of obesity, irregular menses, and acne. So my first question goes to Dr. Gauri as a gynecologist. Dr. Gauri, in this case, young girl with USG report, USG report showing PCOD, obesity, acne. what will be your approach towards such PCOS patient?
Okay, so thank you, Dr. Sushma, for that introduction, and welcome to all the members here on behalf of PCOS Society of India, and nice to see you all here. So moving on to the discussion, that like Dr. Sushma said, a young girl who comes walk-in with a sonography report, and generally it is the mother who is very worried that my daughter has got now PCOS, and because there's so much information going around the social media about PCOS, that it is more of a worry than anything. So I would like to say that young girls, first and foremost, they should not be diagnosed as having PCOS based on the ultrasound report. Ultrasound report can just be used as a kind of a guideline, or generally what we do is that we consider PCOS in young girls, especially between 13 and 20, that we wait, or 18 I would put, we wait for, because their hormonal cycles are still getting established, and at this age it is possible to see some cysts on the sonography. So just seeing one sonography report which is saying PCOS is not the right way to diagnose PCOS, especially in young girls. So I would always want to counsel the mother that, okay, you have a report like that, and PCOS is not something which you have to be frightened about. Although there is no definitive XYZ medicine for that, it can be very well controlled. It can be very well taken into consideration that, yeah, she is at high risk. And the simplest thing, always I try to make them feel that it's very simple. What can you do is manage your lifestyle. If you manage your lifestyle, you are in control of PCOS, and the moment you leave that PCOS free for some time, it's going to revert. So it is not that today, we have patients, Sushma, coming in and saying, last year I had PCOS, then this year I don't have PCOS because my sonography is showing something. Then after that, we are seeing some PCOS. So PCOS is just a condition that is seen on the sonography. Young girls should not be diagnosed on only a sonography report. But yes, these girls who are young and then they are showing me symptoms that they're overweight, because now we don't use the term obesity, we always use that they are healthier or they're overweight. I definitely never talk to girls saying that you're obese or something. It's always young girls want to say, I always prefer to be that you're overweight, and then that's true because they are overweight, so that's fine. Yes. And so they are counseled for that first. I always prefer that counseling and telling them that lifestyle will help is the first positive step that the mother and the patient or the girl has to be reassured with. Generally, we will never start medications for these girls to, at the first go. I always want them to take control of their own situation with healthy lifestyle. And then, if that doesn't work, we are always there to help with whatever specific symptoms that they have. So I think for a young girl, Sushma, this is what I would prefer to do.
Yes. Yeah, very truly, you said, Gauri. I've seen, young girls, they keep on, especially mothers, they keep on repeating the sonography report every 6 months, 1 year, So very rightly you said. So can you elaborate about the hormonal status we see in PCOS? Like, what are the hormonal changes will be there, with PCOS?
So PCOS, basically, we have to understand that none of us know, there is no definitive cause known. So we don't have that, this is the cause and this is the treatment. So PCOS is a lifestyle disease. Sometimes it comes in because of, if there is a family history of diabetes, those girls are more likely to have PCOS. Secondly is that already overweight children. So we have children who are overweight right from the time when they are younger. So they are the ones where you need to be more careful about that, because they are likely to have PCOS later in life. Also those girls, now that we see that, those who are born, because since we are gynecologists, I always prefer to take the birth weight history. So those babies who are born very low weight, they generally tend to have PCOS in the later life. So we have to keep a watch, that they've been low birth weight, then yes. So we have to keep a more watch on these kind of people. So the second thing is that what about the hormonal status, if you ask me, it is basically is that a lot of tests are done to diagnose PCOS. But like I said, in young girls, it is not advisable to do any hormones to diagnose PCOS, especially in adolescent age group. Once they cross the adolescent age group, nowadays what we prefer to do is an AMH, that is a blood test, and that blood test gives us a reasonable idea as to what is the status of the PCOS condition that is affecting the girl. But again, I can also put a word of caution that don't rely on a single AMH report. One AMH report doesn't really, give you a complete picture. There is no report equals to status. It is a continuous individualized treatment or plan that each girl will have to have. But yeah, so there's no specific hormone, but always before we come to a conclusion that this is PCOS, always prefer to check whether she has any thyroid problem, whether she has any other hormones that are not working well, which are causing that excessive weight gain or all these kind of, hormonal changes that she is seeing. So it is always better to exclude everything else and then come to a diagnosis that, okay, now this is likely to be PCOS and nothing other. We should not be missing on that.
Yes. Thank you very much, Gauri, for, giving this information. Now, Dr. Gauri, as a gynecologist, she has seen that young PCOS girl, and she's referring her to the dietitian, Ksitija Gaikwad. So, Ksitija, this question for you. Is there a specific diet for PCOS? Ksitija?
Yeah, muted Ksitija.
Ksitija, please unmute yourself.
Yeah, she is in.
Yes.
So,
Yes.
should I repeat the question, Ksitija?
No, I heard that. Okay.
Yes.
Yes. We can say that there is no specific diet for PCOS, but definitely there are some principle of diet they should be follow for the better conditions. Like they should follow healthy and balanced diet. Then what is balanced diet now? So why even is the question arise, what is balanced diet? Did our mom or our grandmom think about that low carb diet, low fat diet? No, yeah, actually they are proud of that diet because then why the question is about getting a balanced diet? Due to some bad dietary habits, it arises. So now we see what is the balanced diet. Balanced diet means 60 to 75% calories you should getting from the carbohydrate, then 25% from the pulses and legumes, that is protein, and other from the vitamins and minerals and fats, that is 10% around. So we can say there is no need to starve yourself for weight loss, or there is no need to eating less to for PCOD, treat PCOD. You should take balance and avail habitual balanced diet.
Sushma, you're muted.
There are so many conditions. Hello, am I audible?
Yeah.
Yeah.
Yes. So never go for the restaurant food, processed food, and refined food. Always go for natural farm food. Never go for refined oils. They interfere in our hormonal changes. So always go for the cold press oil, or or you can say desi ghee you can use. Then always includes a good amount of fruits, vegetables, leafy vegetables, all kind of vegetables you can include so that the conditions will be getting better. Then avoid unnecessary refrigerations, microwaving of food. It will help also. Then always prefer jaggery rather than sugar, unrefined sugar. You can go for that. And of course, always learn to differentiate between hunger and temptation. Is you are really hungry or just getting temptation about eating? So this is also work betterly. So then drinking lots of water is also helpful to regulate the our insulin levels and hormonal levels too.
Yeah.
Okay,
So,
thank you, Ksitija.
so can I add one
now,
point here, Sushma? Yeah, so I
yes,
think what Ksitija is trying to tell us is that we have to have young girls and everyone rather moving towards fresh foods, foods with lesser
yes,
preservatives. In fact, no preservatives. We have to move to foods with no preservatives.
yes,
Then we have to always cut
Yes,
down any kind of artificial sweets in our food. Anything where sugar is added or sweeteners are added, if that is under control, then that is something which has shown to work. Am I right, Ksitija?
yes.
yes, definitely.
Yeah.
Okay. So
Always
my
take
next
your
question is to,
meal at fixed time.
yeah, you want to add something, Ksitija? No? Yeah. So my
Yeah,
next question,
take your meals on fixed time as per your
Yeah, she wants to say that you should
as
take
per
the
their
meals at
routine.
fixed times. Yeah, but you know what, Ksitija, the commonest problem that we have
Yeah,
is girls will
never
say that
skip
I have
breakfast.
my college, then I don't have time for breakfast, then I
yes,
have
yes,
so am I not
According to
supposed
their
to
routine.
party? Come on, I mean you're telling a young girl that I'm not supposed to attend birthday parties and have late nights. So how do I balance that?
We can give them a better options to choose mindful eating. Like if they are going with their friends, they can choose South Indian dishes or veg sandwiches without butter or cheese, or they can order any dhokla kind of thing which is not fried. So mindful eating will definitely
Yeah,
help them.
nice.
I think the
Thank you.
best thing they can avoid is cold drinks,
Yeah, so what she said is
Yes.
mindful eating. I think
Yes,
that is a very important
yes,
word that she has given to all of us, that
yes,
mindful eating is something which is everyone can follow and you don't have to give up your social life for something like this. Right?
yes,
Yeah.
yes. So the next
Yes.
question goes to Yashashree, who is exercise expert. Just tell me, Yashashree, what is the role of exercise in PCOS and how you will motivate this young girl to start exercising? Because as Dr. Gauri said, these girls are very busy with their, they have that excuse that we are, and sometimes they are really very busy with their college, coaching classes, school timing, tuitions. So how you will motivate her to start exercise?
Good evening, everyone. So, because of this sedentary lifestyle, everybody is too busy with their own routine and they don't have time for themselves. So, we should be a role model to our kid. If you start from yourself, your kid will mimic you. What you do, if you only exercise, your kid will also spare time for exercising. And you can make exercise short and crisp, right? It's not you give only 45 minutes or 1 hour for exercise. You give 20 minutes, but do mindful exercise. Give time for yourself, what your body is doing, what muscles you are moving. So it will help to reduce the stress. It will also help in controlling your thoughts. It is very important. When you tell that my daughter she missed her chums this month, she's late by 15 days, oh, something is wrong, something is wrong. You will start hammering these thoughts that something is wrong. So controlling those thoughts, physical exercise is best. And if you don't have time to move your body at all, if you do walking also for 15 minutes, it will be helpful. Yes.
Yeah, so
Yes.
I would like to add
Yes,
here
the
that
motivation
today,
should, I think the motivation should come from the parents,
Parents
which is,
itself, yes.
yeah. And
yeah,
what is the
so
role of exercise in PCOS? How her, exercise will help her to control PCOS?
It will balance the hormones.
Okay.
It will complete the balance. It will balance all the
Yes.
hormones, and few exercise modifications are there. Few postures which are excellent for PCOS. Few twisting practices are there.
Okay.
No inverted postures, but few practices are there which has given excellent results to control PCOS. If you
Okay.
control
And
your mind, you
just
can control all the disorders.
very true. And
Yeah.
tell me how much weight loss you expect from such girls? Should they go by weighing scale or body measurement?
Body
Because
measurements.
many girls, they do exercise, they keep on checking their weight on the weighing scale, and actually, there is no weighing scale not showing weight loss and they get discouraged and they stop doing. So
True.
what is your, how you will guide them?
I always tell them, do not look at that weighing machine. It is just a number. Look at yourself first. See your body. Your muscles, they will get toned. Muscles toot ke girte nahi. They don't fall, right? They don't go anywhere. They have to get balanced. So always look after your body, muscles, and train accordingly. If you keep on checking the numbers, it will always discourage them only. They always try to, they have set high goals, and when they don't achieve that goal, they get discouraged, they get demotivated. Well, like I'm taking so much of efforts, and still I'm not able to lose that weight. And then they will stop completely, they will stop all the activities. And again, everything will start from A.
Okay.
So I always tell them, go slowly, set small, short goals. And when you achieve that goal, treat yourself. Your body gets more motivated. Then again, you set next goal, you achieve that, and it's very important. If you can't practice alone, practice with a partner. Have someone with you to practice. That motivation comes when you have some or the other person to do practice with you.
Yeah. So can I add something, Sushma, here?
Yes, definitely.
Yeah, so I think this discussion is moving from mindful eating to mindful exercise. So, that is something which I think today's mantra is going to be mindful rather than anything. But yeah, I would just like to add what Yashashree said. She has made a very important point. That is that, that your muscles will speak for itself, because now that research is coming that it is not only the body mass index or the body fat, it is also your muscle mass which is going to determine how your hormones are going to work. So even if, your muscle, you have to tell the patients or the girls or the women also, because we have women of all age groups coming with PCOS, that it is your muscle mass which is really going to determine something. And even if it is not seen on the weighing scale, if it is seen on your measurements, which is fine. And you must encourage them to have measurements, not every day, but maybe at a regular interval of a month or so. And more important is that if they are not still losing weight or showing changes in measurement, tell them कि visceral fat बहुत है. When that comes down, then your muscles will also show you it is getting lost somewhere. It's not that it's not getting lost anywhere. And that is what matters. One more thing to exercise, Yashashree, I would like to just ask, I'll just talk on behalf of Sushma that we generally, because I also advise yoga for my patients. So what is the role of Surya Namaskar in this? Because I feel that just 5 or 10 minutes for Surya Namaskar is a complete exercise. So what is your opinion on this?
Yes, true. Surya Namaskar is the best form of postures. It adds all type of postures: supine, standing, sitting. All parts of your body get stretched, and when you do it with breathing, your complete focus is on your body only. What are you moving? When you take both the hands up, when you inhale, your hands are up, your upper body is getting stretched. When you exhale and bend forward, your lower back is getting stretched. All the muscles are stretched, all the organs get activated. When you do only 5 sets of sun salutation, Surya Namaskar is best for all the practices. It will help to reduce weight, it will improve your sleep quality also, and also it will control your anxiety, depression, and everything will be under control. Even it will help to balance hormones as well.
Thank you.
Okay. Yeah. Thank you, Gauri. And thank you, Yashashree.
Thank you, ma'am.
Now to Dr. Teja. Now this young girl is, we have advised her healthy diet, exercise, but she is only worried about her acne. She's not bothered about her obesity and irregular menses, So first question to you, that how you will deal with her, and what are the skin changes, common skin changes seen in PCOS?
I would deal with her like I would deal with any other patient of mine. If she has already been advised by a good dietitian or by a good exercise specialist or a gynecologist about the lifestyle modifications, I wouldn't really repeat it, because then they're not really listening. So I think if that has already been done, I would take care of the thing that she is consulting me for, in this case, acne. How will I treat acne? Well, we have a lot of things in our armamentarium, like topical drugs like antibiotics or benzoyl peroxide or adapalene. We have systemic drugs like retinoids, which work wonders. We have systemic antibiotics. We have peeling agents, chemical peels, which are very, very safe and very effective methods. Because I think this is a very vicious cycle, and at whatever point it gets broken, it is great. So ideally, we say that you look at the root cause and treat the root cause first. But here I would say, like, it's like, if there's a fire, you put it out and then you try to find the reason and sort that too. And I do make it a point to tell them that these treatments are going to work for you, but if you don't make the lifestyle changes, and if the underlying condition is not corrected, then it will be a very temporary response at best. And it may even be a suboptimal response. Now, how I would choose a treatment, acne treatment for this particular patient will be tailor-made as for any other patient. It depends on many things, like the grade of acne, whether she has just whiteheads, blackheads, or big ones, or pustules and really painful acne. Then her profile, if she is, if her looks are affecting her career opportunities, I would treat differently. If this is a young girl going into clinical depression because of acne, maybe I would treat her a little more aggressively. So we have a lot of things in our armamentarium, and the treatment would definitely be tailor-made. Now, what other things do we see? Pimples is the commonest, and we also see hirsutism, also a common presentation. Many cases of hirsutism are because of PCO, and some are not because of PCO. What is hirsutism? It is the growth of terminal hair, that is thick, dark colored, coarse hair on areas where you wouldn't really find such hair in a female. Like, for example, the upper lip or the chin or the side locks, or maybe even the arms, chest wall, back, these areas. And it has a huge effect on self-esteem. It causes a it causes a good drop in self-esteem. And treatment options here are simple. You get rid of the hair. Like, because even if the patient is getting treated for PCO, her hair growth may not really respond so well. And temporary methods, everyone knows, something like waxing or bleaching to get rid of the color, or plucking or threading or shaving, whatever. And then the most preferred would be permanent hair reduction, which is laser hair reduction. So basically for hirsutism, you get rid of the hair. Now coming to the other presenting symptoms, acanthosis is very, very common, especially insulin resistance, and they present with a dark color on their neck. This pigmentation looks different from skin tanning. There's this velvety thickening that we see on the neck, in the underarms, and sometimes on other areas also. And there are some creams to get rid of that, but then these respond better to lifestyle changes than hirsutism or something. And then there is hair loss. Again, very, very common hair loss that we see right here, mainly on the vertex, on the crown area, and especially in the front. That also causes loss of self-esteem, because it may make the woman look a little older than she is, because the changes are seen with age. But in patients with PCO, we may be seeing them very early on. So basically, these four things are those that we commonly see in our OPD when they present to us.
Okay.
Sushma, can I add one thing?
Dr. Teja, do you advise laser treatment for hirsutism in young girls?
Young, yes, why not? Young, what do you mean by young? If she's 18 plus, then lasers anyway we do very commonly, even for those who do not have hirsutism. Below that, also lasers are absolutely fine. There is no contraindication. If the skin is a fair color and the hair is black, that is the best for lasers. Even if the girl is 16-year-old, we can still go ahead with lasers. However, with these underlying conditions, we are not in a position to tell them how many sessions may be needed. But we don't really wait till she's 18 or anything like that, because just imagine a 15-year-old or a 14-year-old going to school with a lot of hair on her upper lip. Because even with the temporary method, something like shaving, it is, the stubble is still seen, and it makes them extremely prone to hearing very negative comments, and it is very, very stressful. So there's no contraindication really for a young girl.
Okay. Okay. So, like, if she started at very young age, that means she will need lots of sittings, laser sittings.
She may need a lot of sessions. Usually 8 sessions, 10 sessions are commonly needed. If her underlying hormonal imbalance gets corrected better, if she makes good lifestyle modifications, if her PCO is under control, or whatever is causing the hirsutism, like maybe insulin resistance, maybe high testosterone, whatever it is, if that is corrected, she will respond well to lasers. Response may even be seen after 3 or 4 sessions. So for response, there is no complete response. That is, there is no 100% reduction, but even 75-80% is good. But that will come after 7 to 8 sessions usually. And in people with underlying hormonal imbalance, they may keep needing maintenance sessions maybe every few months. So yes, she may need, not if she starts early, especially if the underlying hormonal imbalance is not corrected, she may need more sessions. So laser treatment will always go hand in hand with the correction of the imbalance.
Okay. Thank you, Dr. Teja. So because in practice we have seen the mother and daughter, in fact, I can say the family, they are more, worried about her aesthetic look rather than their hormonal imbalance.
Yes,
So
absolutely.
now my next question to Dr. Gauri. Dr. Gauri, just tell me one thing. Now this young PCOS girl, we have advised her healthy lifestyle, eating habits. She's taking, treatment for acne, hirsutism. So will you wait for some time or you will start her on some medication? And just tell us something about the OC pills, like, I have seen young girls or, 20, 22-year young girls also, they say ki doctor has given me 21 days tablet. I took it for a few months. And after stopping that medication, again, my cycles have become irregular. So please guide us something about the OC pills also in PCOS.
Okay, so here I would like to make 2 comments to what Teja said. One thing is that we must all be very vigilant about acanthosis now, that because acanthosis even will come even before the PCOS or whatever hormonal imbalance has started. So this could be a kind of an very early sign. So in practice, or even in women in generally in the public, the society, they should know that they have that excessive darkening of skin and something called as acanthosis. They should know that there is something wrong, and they might need they might go into a PCOS pattern, or they should be careful about their lifestyle right away. Secondly is like what you have asked me, Sushma, and what Dr. Teja also mentioned, that treatment is necessary, and it depends upon why she is attending the clinic or what is more disturbing. See, when we are talking about a PCOS girl or a woman, what disturbs me might not disturb somebody else to that extent.
Yes,
so
right.
What is actually disturbing her is more important. If the cosmetic issue is more disturbing to her, we cannot undervalue her concern. So we have to first, as a clinician, it is our primary duty to find out what is the major concern. And I think Dr. Rucha will also agree to this on my point, that what is my concern is more important than what is actually needed. Secondly is that as far as these OC pills are concerned, one thing is that we try to avoid cycles which are, if girls are getting reasonable cycles, say up to from 21 days to 45 days of cycles, generally I don't prescribe OC pills, because it is better that, they set it right with their hormonal status, with lifestyle changes. But, there is a concern that if the cycle is longer than 45 days, or if it is required, like for acne or for any associated hirsutism or eye hair growth or for any other associated condition, then there should be no restriction about giving it. But yes, equally true is that they should know that this is not like, you're given for 3 months and then you're like all done, because it is a lifelong susceptibility to having this PCOS. See, you can't say you're a patient. PCOS people are not patients. They are girls or women who have this susceptibility to have these changes. So they are not ill, but they're likely to be ill. So they need to know that if I want to be in the healthy category or in the healthy basket, I have to maintain my lifestyle. And if I'm maintaining my lifestyle, it is going to be a lifelong process. And to have a healthy lifestyle all your life is something good. So there's nothing wrong about it to have a healthy lifestyle. It's like, it's just like you enjoy a cup of coffee. So it's good. So you do it lifelong. Similarly, healthy lifestyle is lifelong. So I follow this lifelong. So this is giving OC pills for 3 months is not going to cure something. It is going to help you to resolve any other issues that you have, or related to menstruation or to periods. So, and it is also going to help with weight loss and things like that. So it's going to help for a short period. The more you improve your lifestyle, the lesser duration of medications will be required.
So you will suggest only for 3 months, Dr. Gauri, or you can extend it?
See, as I said, it is individualized. You cannot put a PCOS patient like into, like 2 months of treatment, 3 months of treatment. Like it depends upon how a particular person is responding. It depends on what is the pathology of, how much she has progressed into a metabolic problem. So that we have to weigh everything, because now we see young women also coming with diabetes, coming with blood pressure issues. They have PCOS in their 30s and the 20s also. So it depends on how long they are going to need it. Also, giving OC pills is not something which they should do over the counter. No, last time doctor had gave me this, I do this, because we see a lot of girls coming with history of severe headache, migraine. They have clots in their legs, like thrombosis that you call it. They have heaviness in the breast. So they should not be taking, this should not be an over-the-counter pill that they should be taking. It has to be and should be always taken under the supervision of a doctor, and as much as you need, just as much as you need. It can't be like, lete chalo. No, not that way.
Okay. So mainly we need is the lifestyle modification that is very much needed to control the PCOS. Okay. Dr. Rucha? Hello? Yeah, Dr. Rucha.
I'm right
now
here.
This young PCOS girls, they have a low self-esteem and negative body image. So do you see other emotional disturbance with these girls in your practice?
Yes, absolutely. So basically, as we have been discussing, PCOS is generally identified, in the early teens. So this is the time when actually a person develops their image, their self-image. So, what a self-image is, that when I close my eyes and the picture of myself that I see is actually my self-image. So it can be an image of my physical self, it can be an image of my emotional self, an image of the thoughts that come to my mind. So it works on multiple levels. And as we have been discussing, because of the multiple changes that happen in the body during a person having PCOS, it is very likely that this self-image is disturbed at the time when it is actually getting formed. So it is very important to, as Dr. Gauri just said, to, not mention these children to as patients. They are prone to develop some kind of illnesses in future, but it is very important to give them scientifically sound information right at the beginning when you come to this kind of diagnosis that they have developed PCOD. Another thing is that what other colleagues of mine here have been saying is that it is very important to practice mindfulness also. So this is the time when you give proper information to these children, their parents, and a good psycho-education is a good healthy start of treatment is what I feel, because you don't want these patients to land up with a psychiatrist for something like a PCOD. So it is always better to have preventive treatments, so very simple things like giving them proper information, something what we are doing like an awareness program is equally important, so that these girls remain adequately motivated towards making these lifestyle changes. And here another thing which I would like to add is that parents being supportive, parents being encouraging and motivating is another very important factor where the girls tend to make changes in themselves. As Yashashree said previously, the parents also need to improve their lifestyle so that the kids improve their lifestyle with the parents. So when a child is prone to PCOD, we must understand that an entire household needs to make lifestyle changes and not just expect the child to make them. Because, ghar pe puriya tali ja rahi hai and the child is expected to eat one chapati and one roti. At that age, it is definitely going to affect that child and she's going to feel left out. So yes, it is definitely bound to have some effect on their mental health. And if this is not taken care of in time, it affects their self-image, it affects their perception of their self, it affects their life choices, career choices, life choices, going out, socializing, everything is affected. And this can subsequently lead to depression and anxiety, which is clinical, and that definitely affects the children having PCOD.
Yes, very true, Rucha. Only the child education is not important. The family should also be aware about this syndrome called PCOS, which is very much needed. One more question to Ksitija. Ksitija, what are different types of diet you can tell very briefly? Can you just mention the different types of diet?
Yes, there are many kind of diet like vegan diet, thick shape diet, then keto diet, and intermittent diet. Yes, but the balanced diet is a very good idea rather than this crash dieting or any Google search dieting. The balanced diet is very good idea, and it will help than this crash dieting or any kind of Google diet.
Okay, that means we have to just take the balanced diet. Okay,
Yes.
and yeah, Dr. Teja, can you give brief information about the laser treatment for hair removal? Very brief.
Lasers are a very, very safe and effective method for hair removal. They are effective for removal of hair that is thick and coarse. Hair that is very fine and has less color in it will not respond very well to laser. Usually, treatments are planned at least 1 month intervals, a little more interval later when the hair growth is slow. What happens with the laser is that some hair follicles get damaged permanently, and in some hair follicles, there is a change that the rate of growth gets slower, or the hair may become thinner. That is, we call it a terminal to vellus hair transformation. So that is also very good. So initially sessions will be placed at maybe 1 month intervals, and later as we see a response and if the hair growth rate is slow, the interval may be longer. In between the laser sessions, the girl or woman should not be removing her hair by methods like plucking or waxing or threading, in which the hair is actually plucked out right from the roots, because the hair root is where the laser works. And to avoid social embarrassment in the meanwhile, we shave her hair with a razor, or maybe she can bleach them to get rid of the color so that it is less visible. There are many different kinds of lasers. For Indian skin, some of them are particularly good, like long pulsed Nd:YAG or a diode laser, or sometimes, or even IPL devices work very well. The number of sessions that I mentioned before would be around 8-10 sessions, and maintenance sessions may be needed later, maybe after 3 months, after 6 months. Lasers work best when combined with hormonal correction. It may be an OCP, it may be an anti-androgen that is given, and this is regarding only PCO patients. If there are other imbalances, those need to be corrected. And then a laser would work. Sometimes I advise the patient to start hormonal correction, and after 3 or 4 months of that, I start laser so that we get a better response.
Okay, we have started getting questions from the public. So my first question goes to Dr. Gauri. Gauri, the question is that I'm 25 years old. I don't have PCOS or any symptoms of it, but still my periods are irregular and flow is less, likely 2 days only.
Okay, so one thing we have to understand that PCOS, irregular cycles doesn't always mean PCOS. Let's get it very clear. Irregular cycles can be because of various reasons, right from starting from vitamin deficiencies to even young girls, when they start getting their periods for the first 2 or 3 years, their hormonal cycle is not yet set. Then also they have irregular cycles. It can be also related to thyroid deficiencies or any other hormonal problem. It can also be because of any other conditions in the uterus or the ovary. So always irregular cycles is not equal to PCOS. Now when you have to actually think about PCOS, it is generally irregular cycles with maybe acne, with maybe hair growth, with obesity, or with overweight problems, or something along with that. So it's not always that irregular cycles means PCOS, but yeah, so if you are visiting your doctor and your doctor feels that you do have any other extra signs, then maybe you are likely to be having this pattern of PCOS. And like we said, that it will depend upon the case on whether you have any of these problems, and then you will be treated. So don't equate irregular cycles with PCOS. There are different various reasons why they can have this.
Okay. Yeah. Okay. The next question is, what is the differential diagnosis and treatment in thin and obese PCOS? To you, Dr. Gauri.
Okay, so it is very nice that this question has come up, that there are not everyone who has PCOS is overweight. Let us get that very clear, because if you go by any definition of PCOS also, it is like any two of these things, like anybody has acne, hirsutism, and irregular cycles, or overweight, or anything. Any of these two conditions is sufficient to have a clinical suspicion of having PCOS. So there are girls who are thin, and the thin PCOS, it is very difficult for them to get convinced also that how can I have PCOS? If I go on the net, it's not written like this. So it is very difficult for them to actually think about this criteria. But lean PCOS do exist, and like we said, why they are lean is because their fat is responding in a different way. But there is something which we call as an insulin resistance. And insulin resistance is something which actually causes PCOS, and whether it is a result or whether it is a cause is still not known conclusively. But yes, they both go hand in hand, is definitely concluded. So PCOS and insulin resistance, that is something which causes this PCOS even in thinner girls. So now there are a lot of studies coming in, whether it is the muscle mass that matters or it is the gene programming that matters. But what matters most is that if you have any of the symptoms of PCOS, follow a good, healthy, happy lifestyle. So that is something which I think is very simple and doable. And of course, but those girls also need treatment, and they also go through the same kind of problems that girls with obese PCOS, except for the weight loss thing. And the commonest problem is, that they will come and say that if I'm already so underweight, why are you asking me to exercise? So that is the commonest problem that they have. I'm thin, and you're still telling me to exercise. So I would like to tell our viewers today that exercise is not only for weight loss. Exercise is to stay healthy. So exercise and weight loss it's a wrong corollary that we have put in. Exercise is for everyone. It is irrespective of whether you're thin, you're fat, you're small, you're big, you're old, or whatever. Everybody must exercise, and that is the thing that people should note for sure.
Yeah, exercise has other effects also on body rather than losing weight. The next question to Ksitija: do we have to stop eating dairy products even if we get milk from local and trusted source? Ksitija.
I think she's been lost her for some time. So can we take another question till she joins?
Yes. Okay. Does PCOS affect the eye number?
No, not known.
Not known. Okay. Gauri, can you answer this? How is Dikshit diet different from intermittent fasting?
Well, see, actually, any fasting program has got their own principles. Okay, now what I think before following any particular program, I always tell my patients, do something which you will do consistently. That is most important. It is not that one is better than the other. It is something which I'm going to be able to follow. Okay, if I'm going to follow something and I'm going to like following it. Suppose if I am a person who does yoga and I will send me to the gym, I will run away from the gym in 2 days. But the question is, if I'm doing what I like, if I'm following a diet which is approachable to my kind of personality, I will follow it. So there is nothing, one is better or the other is less. It's not so, it doesn't work. Secondly, I tell young girls and girls who want to get pregnant that you are going to go into a phase where you want to get pregnant and go to give birth to a child. So don't go into some crash diet or those kind of Ayurvedic preparations that some preparations which we don't know as clinicians. and where they suddenly lose weight. So we go under the guidance of somebody. Don't go by somebody who is giving you this product and saying it is good. Go to a doctor, whatever pathy you are following, but go to a doctor, see that it is under a guidance that you're doing this weight loss. Because more often we see that girls who are doing weight loss under no program or on their own, they will have vitamin deficiencies, they'll have vitamin D deficiencies, and they're losing their own proteins also at some time. So it really doesn't work like this. So that is why they need to do it under guidance, and that is more important. So no diet is better. Now intermittent fasting, since Ksitija has joined, she can talk about this. We had lost you, so I had just taken up this question.
Difference Dikshit diet and intermittent fasting. What is the difference?
Network issue.
Okay, so yeah.
Okay. Hello.
Ksitija?
Yes.
Difference between Dikshit diet and intermittent fasting. We have to hurry up. Only 5 minutes are remaining. So
Okay. Sorry. In Dikshit diet, you can eat only 2 times. Between you can have chash, tomatoes, salads like this. But in intermittent diet, you have to fast for 16 hours, and your eating window will only 8 hours. So in these 8 hours, you can manage your food choices and food gap, and you can decide what should eat and what should not eat. But in Dikshit diet, you can eat 2 times, but you can eat anything like sweets, carbs, and fatty food, fried food. You can eat, but only 2 times. But in intermittent diet, there are some restrictions, like you should eat only fibrous food, protein-rich food, then foods which are rich in vegetables, and not fries and sweets are allowed in their diet. But in Dikshit diet, you can eat everything.
So I have a question for Dr. Rucha. I have not typed it.
There is I'll ask one question to Rucha. I think there is no more question from the public.
Is there any more questions? Yeah, there are some more questions, Sushma. I can see them. So there is one question for Dr. Rucha. The question is, Rucha, that are you seeing that now the incidence of young adolescents or teens or young women are facing more depression, anxiety issues? Is it what we are just we are just thinking that there are more issues, or are they actually, you are looking at a lot of young girls and adolescents having more of these issues?
I think it goes hand in hand, because there is one important thing here to note, that people have become more aware of their mental health issues. That is why the younger generation is speaking out about their issues. I feel that maybe the gynecologists here would be in a better position to say whether the patients were facing emotional issues previously, but they never came out to a mental health professional about them. But right now, the scenario is such that younger women, girls are coming up and taking help from mental health professionals. Say it may be a counselor, not exactly approaching a psychiatrist, but approaching a psychologist or a counselor, wanting to take support for such kind of illnesses. And especially I would like to mention here that if depression, anxiety, these issues are identified at the outset, it is in a mild state. That is why it is easier to treat without multiple medicines, because as I understand, they have a lot of other burdens to take care of when they are undergoing PCOS. So over pill burden wouldn't be an ideal choice. So, counseling, therapy, and as we have been talking, lifestyle changes, and how to implement these lifestyle changes, because there is everybody who is telling the patients to make changes, but then how do they do it? What, one step at a time, how to do it? This is what counseling helps them achieve. And then as they see a difference in their own body, they see a difference in their PCOS status, that encourages them to follow these choices more and more. So yes, definitely a support from the mental health team will definitely improve the PCOS outcomes of the young girls, I feel.
Okay.
So there is one more question.
Yeah, Gauri, there is a question. Did the child get PCOS from the mother?
Yeah, so actually, PCOS and pregnancy is a very different, is a very important and very huge topic. I think we can have a separate webinar on this, but let me just put it that, yeah, so we can just put it is that PCOS in pregnancy per se is like those women who earlier had PCOS. Anyway, we know that those women with PCOS have a problem to conceive. Okay, they have, because like we said, the basic pathology is where they don't ovulate normally, or they have a problem with ovulation and other hormonal issues. And can we have you having some disturbance from somewhere at the background? Can we have some help? Yeah. So so they're already having a problem with conception because of their ovulatory status. After they conceive, they are at higher risk of having diabetes in pregnancy. They are at higher risk of having hypertension in pregnancy, or they are having a problem where their babies will have a little lesser weight also. So now, whether it is conveyed from a mother to the child, so there are now newer evidences coming that yes, it does definitely. There are studies which are showing that there is a correlation between the mother and the child when it is likely to get transmitted. But again, the important thing is that you can always delay the onset of any hormonal problem. Something which is like a very important, you can say a tool in your hand is that, okay, you are likely, like we also counsel our patients with diabetes. If you have a family history of diabetes, at some time you might get diabetes. But what can you do? You can do everything with your lifestyle, in the sense your diet, your exercise, your life plan. You can always delay its onset. Similarly, those who are having PCOS mothers are likely to have PCOS in the children. The best thing is that you yourself, like, Yashashree said, you go into a diet plan, you go into a good lifestyle, your children are going to automatically follow it. So that is something where your intervention should begin. Oh, I had PCOS, I will do everything to prevent my child from going into this. You can't overdo it, but yes, you can definitely do it up to a particular limit, and you can try to avoid this whole situation. So yes, there are evidences that say that it can be transmitted. Yeah. So
there is a dairy products have to be avoided even if the milk is locally sourced.
No, you should not eat. You should not omit all dairy products, but it should be in limited amount, and with low fat dairy products like paneer, church, curd. You can have in limited amount.
Okay, there is a question. Now influencers are promoting PCOS gummies. How safe are they? Can any one of you answer this question?
No, I would not recommend to go into influencers unless and until there is an evidence. Don't go for any influencers. I mean, let us be authentic and not go for any kind of these influencers.
So next question is how to reduce weight in PCOD patient with thyroid deficiency, weight 85 kg, 21 years old female on thyroxine and spironolactone.
For me or exercise?
We can start with the diet.
Yes.
Okay. They should plan their proper diet from experts. They should maintain their physical activity, like cardio exercises they can include, and a diet like some changes like you can start your day with antioxidant drink like methi water or cardamom water or cinnamon water. After that, go for a cardio exercise for at least 1 hour. After that, do not miss their breakfast. They should breakfast with a high protein diet, like they can have chila or idli sambar, or like any boiled sprouts they can have. After that, they can have a snack time, mid-morning snack like fruit, any kind of seasonal fruits. Don't go for any exotic food like avocado. You can have any kind of local food which is available nearby you. Then you can have a balanced lunch, then which is low in carb, but high in vitamins, protein, and minerals. After that, evening snacks, they can have makhane or roasted chana, or along with green tea, or without sugar, coffee or tea. After that, in dinner, they have to finish their dinner by 7 to 7:30, and don't overeat at night. And they can have a little bit a light dinner like khichdi or burger or suji, like that.
There is a question. Is there any particular age that a girl can develop PCOS? I think there is no particular age to get PCOS, na? You can get it at any age. I'm right, Dr.
Basically,
Gauri?
yeah. See, PCOS, to get PCOS is not like getting a common cold, okay? So you are basically, you know that there is a susceptibility to develop PCOS and PCOS-like symptoms. Now, when you will develop it, it depends upon what has been your past history, what is your family history, it depends upon that. So whether you're susceptible to PCOS or not is like, there are a lot of criteria which tell us that, okay, these girls, like, those who have been overweight, whose parents have diabetes, or who have a poor lifestyle, even for that matter, a lot of psychological stress, all these girls are likely to develop PCOS. In fact, I was going to ask Dr. Rucha that have you seen that girls who are young girls and they have had a lot of stress, especially, we see this typical period when they are in the 10th, 11th and 12th, when they are going through that career kind of decisive times, they miss their periods, and that is the time when I've seen most of them skip into and they start developing PCOS. So have you also seen this in your practice? Is that those crucial years when they are too much stress from everywhere? So is that a turning point for getting into PCOS?
I think that what you are saying is true, especially women who, are prone to develop PCOS. This stress is enough to tip the scales towards the side of PCOS, So the stress of, say, 10th standard, 12th standard, graduation, admissions, and the lifestyle itself has become so fast, and, competition is so much that just facing these kind of issues and that stress is enough for them to tip the scales towards PCOS. Another thing is that the hormonal changes of PCOS that happen, they will cause a lot of mood swings. And sometimes we do not take this into consideration. Nowadays it has kind of become a thing, just she's like PMSing. So it's very commonly said, and we don't take it very seriously. But we need to understand that these are the underlying hormones that are playing havoc, and that is why this child is having mood disturbances, the crying spells, the anger, the irritability. So the people around this child also need to be quite considerate and understanding that it is not she who is doing it on purpose, or what we say that now it is her age to act up, so that is why she is doing so. But it is the hormones, the underlying condition which is making her do so. So a little bit of consideration would be really encouraging to this child, I think.
Yeah.
Can regular exercise delay the menses?
Excessive exercise delay the menses. Would you like to talk on this, Yashashree?
Yashashree?
Yes, depends on their schedule. We can say if you are using your 100% of energy throughout the day, plus you have to do workout also, your body needs 50% of workout, physical exercise, and 50% your body needs to recover that whatever you have lost the calories and all. If you drain complete 100%, then yes, it will affect your body and it will affect your menses also. It will delay.
So I would like to add
question and very good answer to it.
Yeah, but I would also like to add one more thing, Sushma, here is that your exercise pattern, one thing, it has to be tailored according to what your needs are. Secondly, is that over exercising is one thing. When basically what happens is when you're over exercising and you're also, on a diet, then all your whole hormonal milieu changes. So we have always seen that those girls who begin to lose weight also have a change in their menstrual pattern. So they must recognize that there is going to be a change in menstrual pattern because you're losing your fat. If you're losing because of fat loss, they do experience a change for a very brief period. So it is possible to have it, but then you have to reassure and see that the irregularity is not because of any disease. Then it is okay. They will come back because there is a change in the body fat pattern, and that is something which must be recognized. And don't get worried because of it. Don't give up. Go on. That that's something which they should know.
I think we should keep on changing the exercise, after a few months, so that there will be no monotony, and we start enjoying the exercise.
True.
Okay, sometimes indoor exercise, sometimes outdoor exercise. The next question is, my daughter is 12 and she has just got her period. She has hair on her body more than on her hands and legs. Could she have PCOS, Dr. Gauri?
Yeah, actually, this question, even Dr. Teja would take it because, see, any girl, it is basically when we talk about excessive hair growth, there is something which we scale the hair growth, okay? There is a scale called as a Fermin-Galway scale, and that, according to that, we go into what is the visual, how much hair you can actually see on the body parts. And if it is obviously more than 4 to 6, then it is considered that yes, she does have excessive hair growth. But sometimes I guess, Teja, this could be a familial issue as well.
See, excessive, and she has hair on her body is very vague. And at 12, it would really be impossible to say whether she's going to develop PCOS or not. And right now, if she has PCOS, not really. She's just basically getting into teenage, and just her normal, it is just a normal puberty beginning where the hair changes are going to be there. So she's going to get more hair all over her body. The hair all over her body is going to change. And abnormal hair that we see in PCO or in hormonal imbalance, that is not hypertrichosis, it is hirsutism. So basically, if the hair is thick, if it is coarse, and if it is very dark in color, at least in our skin type, then we might think of PCOS, but not right away. We'll have to see if there are any other changes of hyperandrogenism. Let's see how her periods become regular. For the first 1.5 years, I wouldn't even think of putting a label on it.
Yeah, but I would also like to add, Dr. Teja, that if you have a girl who suddenly starts having excessive hair growth, it is always better because there is, other than the ovary, there is one more place that is called as the adrenal gland, okay, which is situated just above the kidney. If that starts dysfunctioning, there is a possibility that there is a sudden change in the pattern. So any sudden change and excessive change has to be actually dealt by a doctor, and then
have to look at other clinical features, and first maybe a doctor would really have to see whether it is abnormal hair growth.
Yeah.
Excessive, and the scale that you're saying, that is very, very subjective. So we really don't really take it, as a scale. But it's the GF scale, because it says that the one who is observing, maybe the doctor, puts a scale like 0 to 4, upper lip. How much hair is there? 0 is like no hair, and 4 is a lot of hair. There is no quantitation as such. So there are different areas: upper lip, chin, arms, chest wall, and then there are these 9 areas of the body. And then you say 0 to 4, 0 to 4. If it is more than 8 or 9, you say that it is excessive. But again, that is for hirsutism, and it is for thick terminal hair, not just more hair. So more hair, we'll have to really look at the young girl and see if it is abnormal hair distribution.
Yeah, the next question is, please elaborate on seed cycling. Can anyone answer?
Actually, I really don't know what they mean by seed cycling.
Even I am not able to understand.
Diet? Is it related to the diet, the seeds and nuts that we eat?
Yeah.
No idea.
Because
Ksitija, any clue?
Yes, sunflower seeds, pumpkin seeds, they are talking about that. They are more helpful for the fertility. So we are giving our patient the seed cycle, like we include that in pumpkin seeds, then flax seeds, chia seeds, then black sesame seeds, then muskmelon seeds, watermelon seeds. They are very helpful to regulate their hormonal imbalance.
Yeah, I got this. Now I recollect. The seed cycling is basically where they have told to go for, flax seeds, then sesame seeds, and one more sunflower seeds. they take it either as a combination or it is taken as weekly changes. Now it is shown that these flax seeds and sesame seeds, when they are taken premenstrually, they are known to reduce the PMS symptoms and things like that. But as doctors or as clinicians, we really cannot endorse these things. They are all in the dietary patterns, and it depends upon. We can't endorse that this is 100% something as a treatment for PCOS. Not at present.
Okay. The next question is: my height is 5'4", weight is 51. Don't get periods regularly. Shown to doctor, but no improvement. And I'm doing exercise regularly for 40 minutes, but no improvement. What should I do? The age is not mentioned. I think we should know the age also.
So she's worried about her periods not coming regularly.
Yes.
Okay, so let us see that it is not always the weight that is the issue when any woman is not getting her periods. So, getting a regular exercise and still not getting periods regularly can also mean something else to that. And it also depends upon, all patients with PCOS don't respond only to diet and exercise. It also depends on the amount of insulin resistance that a particular girl has or a particular woman has. So it is not necessary that even if she's PCOS, it is likely that she might not respond 100% to exercise and diet. But yeah, you should have to tell her that along with this, she has to add some treatment to her armamentarium and not only stick to exercise if it is very irregular. But like I said, a cycle of 21 to 45 days is acceptable, and you can still continue without any treatment if you are getting your periods between these dates.
Yashashree, this is question from me. What is the role of meditation in PCOS? Because we have seen, they do regular exercise, follow healthy diet, but still, there is no improvement. So I think can you suggest something about meditation part in PCOS?
Yes, staying calm is the important thing. One, in the busy schedule also, after doing exercise in the morning, you go back to your routine, you get stressed, and in the end of the day, you just feel exhausted. So sitting quiet for 5 minutes also is very helpful. Second, focusing on your breath. If you can't meditate, if you just sit quiet and observe your breath, it will help you to calm down your mind, your thoughts, and also it will help you to reduce your anxiety issues.
Yeah, so
okay. Dr. Rucha, any input from you about this, meditation and mental stress?
Yes, definitely. About meditation, I think Yashashree is in a better position to say. But what I would like to add here is that being stress-free definitely reduces the stress hormones and the HPA axis in general, which causes a stress to the entire body. And I think once that is, in order, I think rest of the hormones will definitely, stop playing havoc, and that will reduce the PCOS symptoms. So yes, definitely leading stress-free lifestyle is going to help. So staying calm is good.
And if you can't sit and meditate, you can also just lie down on the bed and just observe your belly movements. When you start observing your belly movements, you can synchronize your breath with your belly movements. That's how you will slow down your mind, thoughts, and you will get relaxed at the same time. Some people, they can't sit for a minute also. They're very restless. So what I suggest them is just lie down on your back and observe your breath, observe your belly movements, and then slowly they fall asleep also with that.
Okay.
Yeah. So in fact, now we are coming up with meditation and programs, even, for patients who are anxious to conceive, infertility patients, those who are facing issues about infertility. And in fact, we tell, both the husband and wife, both the partners to go through this kind of relaxation program when they are especially going through these treatments for fertility issues. So I think it has to be like Rucha and everybody has said it, that going ahead with PCOS is not only one person. It is your family. It is everyone who is moving along with you, to support this kind of lifestyle and treatment issues. It's not a single person's job. It is, you need a lot of support from your family and your partner for going through all this. So I think that is where we have
I think
come.
the take-home message is is that involve the parents, family, partner in the treatment of PCOS.
And be mindful.
That should
Today we
be
have
the
learned to be mindful eating, mindful
Yes.
exercise, mindful meditation, mindful thoughts, and mindful treatment for acne also. So I think
Yes,
that
yes.
is today's mantra for quality of life is to be mindful.
Yes. Vinita, any more question? I think we are finished with all the questions.
Yes, we've not finished, Doctor. There are a lot of questions coming, but we have run out of time. We've superseded our time by like 20 minutes now. So thank you so much to all the doctors. This has been amazing. That's all I can say. The questions haven't stopped. They've continuously been, ting, 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 ting is going on right now. But yes, thank you so much, Dr. Sushma, for moderating this entire event. Dr. Gauri.
Thank you, Vinita.
Thank you, Dr. Teja, Ksitija, Dr.
Thank you.
Rucha, Yashashree. Thank you so much for being a part of this. I think this has been super enlightening, and we've had some amazing questions and the most amazing answers from all of y'all. So this session has been brought to you by the PCOS Society of India, Dr. Darusha, who's the president of the PCOS Society, Dr. Shobna, who's the chair special interest group, Ms. Ruby Sound, who's the co-chair special interest group, and the team of Vijayata. If you have any questions, you can reach out to me, Vinita Mulchandani, on my email ID, which is displayed manager.vijayata.pcos@gmail.com. And we do this awareness program once in a month, mostly Saturday of every month. So in case we haven't been able to answer your questions here right now, do join us. Keep checking us out on our social media. Follow us on social media. You'll keep getting updates on when we are doing our next sessions. And yes, take care. Goodbye and God bless. Thank you, Doctor.